morning, everyone. What we want to do is kind of demystify the process of applying for our grants and really be as transparent as possible about what it is we're trying to do and what we're looking for in our grantees. So when we talk about behavioral health, we really are talking about the broad range of mental health services and substance abuse needs. This term includes mental health needs such as depression and anxiety, but it also includes substance use needs such as alcohol and drug use. So I'm going to jump right into it and review our RFP. Our overall aim of the initiative is to support the expansion and enhancement of existing behavioral health programs and services. And we want to do this through a couple of ways, either integrating these services into new settings where they haven't traditionally been, or using innovation to improve how those services are being offered. And this was really our primary focus in our first year of the Behavioral Health Initiative. And just to give you some examples of what we mean by this could be a clinic who applies to enhance their behavioral health services for their patients by partnering with a behavioral health organization to provide existing their programs in the clinic setting. So taking a behavioral health program that probably exists in other places in the community and embedding it into the clinic for clinic patients. Another example, and again, these are just examples, don't write these down. And if they sound a lot like your program, I promise I didn't steal from you. Another example could be a behavioral health organization that's collaborating in developing new methods of providing their services through either telehealth or apps or some other form of technology. And so that gets more at the technology and innovation piece. In this second year, we did add a second purpose. We really want to encourage investigating policy and systems change, both internal, kind of big P and small p when you think about policy change, that will support the expansion and enhancement of behavioral health services. Because we know that all of the great work you're doing, all of these programs don't exist in a vacuum, that there are conditions that sometimes hold the problems in place. And so not only do we want you to expand the great work you're doing and expand these programs, but also think about how might we change some of these conditions. And we know that this is a long-term fight, but we know that we can't just do great programs and ignore the conditions, the environment in which they exist. So we're asking that grantees embed policy and systems change efforts in their proposal for this year of the grants program. And so, again, to do some level setting, when we say policy and systems change, we're talking about significantly altering existing or enacting new rules, procedures, guidelines, laws, codes, and other governing conditions, either internal or external, that impact behavioral health in Santa Barbara County. And I will say we're not just thinking about policy changes, right? We know that's a really lofty goal, but also just thinking about internal practices, the relationships you have with other organizations. Systems change is more than just creating a new policy. It's really thinking about what are the conditions that exist that make this problem really hard, and how might we partner together to address those. So think fairly broadly when you think about policy and systems change, and not just about we're going to advocate for this one policy. And some examples of, again, embedding policy and systems change into your work could be a clinic could partner with other organizations to develop new policies and procedures that address barriers to their residents receiving behavioral health services, or behavioral health organizations collaborating together to create new referral processes for clients to better access the appropriate services to address their needs. So, you can be really creative as you start to think about how you embed policy and systems change efforts into your proposal. So our goals are to ensure that individuals and their families struggling with behavioral health needs have improved health outcomes and quality of life in South and Mid Santa Barbara County, which is the area we're really focusing on at this point in time. But we also want to gain a broader understanding of the types of behavioral health programs and services in our community, including prevention and interventions for all ages. So it really is about understanding kind of how we move the needle to improve health around behavioral health, but also getting a greater inventory and understanding of the services that exist in our community. And so we have some fairly lofty outcomes that we are relying on our grantees to support us with achieving. And those outcomes include increasing access and utilization of evidence-based behavioral health services and resources, improving knowledge and awareness of those behavioral health services, and reducing stigma around behavioral health, and then lastly, improving the policies and systems to support and sustain the increased access of those behavioral health services. They're really lofty outcomes, but we have to put our stake in the ground and say this is where we're trying to go. So how do we intend to get there, or how do we intend for you to get there? We wanted to provide some guidance on the strategies that we're looking for, and some of the, not restrictions, but the requirements around the strategies that you would propose in your application. It's important that the strategies that you're proposing or the program that you're proposing be evidence-based. And when we say evidence-based or evidence-informed or best practices, essentially what we're saying is that there needs to be some research or data that supports kind of the foundation of your program or the approach that you're taking. And we know that in some areas, it's still exploratory, it's new, you're adding to the field, you're building the field and adding to the knowledge base, but there needs to be some sound foundation behind your program, which I'm sure you've all thought through, but you just have to communicate that to us so that we can understand why you're taking the approaches you're taking, or why your program is set up in a specific way. And if you have additional questions around that, we'll talk about the technical assistance we're providing over the application phase, and we can provide additional support if you have questions around evidence-based. We're also requiring that the strategies or the program that you're implementing be sustainable after the grant period. And before you guys start to raise your hand, like, how can we do that if you're just funding for a year? I think what we're saying here is that we want you to demonstrate that you're thinking through how you might sustain the program after grant funding. Because one of the things that we're cautious of is that we don't want to fund something that is dependent solely on our funding, so that when priorities shift, this great program that's doing such a great service to the community disappears. So we will be thinking through with you when grantees are onboarded. We continuously have conversations about sustainability, but we also want you to demonstrate that you're thinking about how might you sustain these programs in your grant application. It's important that the strategies incorporate policy and systems change efforts. As we said, this is a new requirement in this grant period because we realize we can't just do programs. We have to think about the conditions in which these programs exist in our community. And then we are wanting that the programs or the strategies you implement be an improvement on an existing program or service that's already shown to have some promising results, or that it be integrating behavioral health services into a new setting, like say a clinic, a school, a community center, maybe some non-traditional settings where behavioral health services haven't been integrated before. In terms of our target population, again, we're looking to start in South and Mid Santa Barbara County, dealing with mental health and substance use issues, or for those living in those areas dealing with substance use and mental health issues and their families, and the broader community within South and Mid Santa Barbara County for kind of the prevention work. So then in terms of what we're wanting you to demonstrate for impact, we want to look at impact on individual serve. So we need to understand how many people will be served by the program, the type of services they will be receiving, knowledge and awareness of services provided, if there's a change and shift in knowledge and awareness, indicators of reduced stigma depending on the population you're working with, and also want to measure individuals connected to other services as a result of participation in your program. But because we're also requiring collaboration, we want to measure that as well. And so we're asking that you demonstrate. And these impacts are really things that we're going to be asking for you to think about how you're going to measure them as a part of your evaluation plan and the development of evaluation plan, which I'll go over as a part of the application. And so we're asking for you to also demonstrate impact on the lead and partner organization. So we've asked you to collaborate, but we want to know, is anything happening? What benefits exist for you collaborating and working together versus maybe doing the program on your own? So are we seeing increased sustainability of the services due to these partnerships? Impact on the reach of your program? Are you able to reach more people or maybe different populations? Increase organizational capacity? Or demonstrating progress towards policy and systems change as a result of the collaboration. So now to the meat of it, which I'm sure you're all interested in knowing. So for this grant, we are, the requested amount is a max of $100,000 for the year. And the budget should really be aligned with the proposed strategies. And it's something that we really look closely at. Do the proposed strategies of the program fit the budget that you're requesting? We do have a cap on indirect costs of 10% of your budget, and additionally a cap on capital projects, things like purchasing equipment, creating new spaces, of 20% of your budget. Katie talked about the Community Health Coordinating Committee. They review the applications and they make funding recommendations to our leadership. And the grant period is 12 months. In the last grant cycle, we had a 3-month planning phase and then year of implementation. This cycle, we won't have the planning phase, so you'll jump right in January 1st, and we're anticipating that grantees will be ready to hit the ground running and begin implementing their programs January 1st. But here's the exciting part. You get a lot of support. If you're a grantee, the evaluation support that comes along with our initiative is workshops, peer learning opportunities, and one-on-one technical assistance from myself and Maddie. Very exciting. Also, tailor support for grantees to refine their evaluation plans. So we're asking that you develop evaluation plans, but you may have varying levels of expertise and experience with developing evaluation plans, and we're not expecting perfection, and we'll be there to support you with refining those throughout the grant period. We do monthly check-in calls with our grantees. We capture, it's an opportunity for us to capture process data and understanding what it takes to do the work that you're doing, but also this is an opportunity for us to talk through any challenges that may be coming up as you're implementing your programs, and then identify if there's technical assistance or resources within Cottage that we can tap into to support you in implementing your programs. And then also we provide guidance on what data to collect and methodologies. Maybe you're like, we want to do this survey, we don't know how to develop this survey protocol, we want to do key informant interviews, we've never done them before. We're here to support you with thinking through those methodologies and data collection tools. Very exciting, right? I think they're exciting. And so we're looking to award grants to community organizations within Santa Barbara County that have existing behavioral health programs. The reason why we're focusing on existing programs is that we know the time and effort it takes to start something from scratch, and we want to put our money behind existing programs and really help them enhance and spread. And so this could be nonprofit organizations, universities, hospitals, and government organizations. For-profit entities can apply, but through partnership with a tax-exempt organization. So they can't be the main applicant on the grant, but can be a partner. So our selection criteria, again, trying to demystify all of this. What we are looking for, I think we've said it probably 5 times already, evidence-based best practices. We really need to understand what research, what data, what evidence do you have to support the approach that you're taking or the program that you're utilizing, the curriculum that you selected. Sharing with us and really laying that out in the application is going to be really, really vital and important. Capacity to evaluate outcomes. As Katie mentioned early in our presentation, that this new direction that we're taking with our grants program is focused heavily on evaluation. And so we want to ensure that our grantees have the capacity to do the work. We know it's an additional, doing the program, delivering these great programs is work in and of itself, but we understand it's additional work to evaluate those efforts. And so being able to demonstrate that you have the capacity to take on the evaluation expectations of the grant. Incorporating policy and systems change. Again, we did not require this in the first round of the behavioral health initiative, but we are asking that you are adding a strategy around policy and systems change with your partners. And multi-sector collaboration. So I think this is an important piece to stress because we're looking for true collaboration. So not having someone just kind of written into the application, right, and getting the MOU, but really understanding how are you partnering together to do something different, and that you truly are delivering these efforts, these programs together, and that the partner is not just creating a new avenue for you, but not really invested in the program or that you're implementing. So just think through those partnerships and ensuring that there's true collaboration there, because we are looking at that and looking for that in the application. And then lastly, potential for sustainability. I think a potential red flag is if we see that there's potential for the whole program to disappear if our grant funding ends. And while we are committed to behavioral health and continuing to fund in this area, we don't know where everything will end. And the thing that we would hate to see is to invest in these great programs and then they disappear because funding priorities shift. And that's something, again, not that you have to have it all figured out in your grant application. We will be talking about it and working with you. It's part of the technical assistance as you are onboarded as a grantee, but it's important that you start to think about that and demonstrate your initial thoughts about sustainability in your grant application. Hopefully that demystified it, sort of, kind of, right? Trying to be as transparent as possible. So in terms of grant requirements, we are requiring MOUs with all your partners. That needs to be submitted with your application. If you're onboarded, we also are requiring, but I think it's not necessarily a requirement, but you get to participate in these monthly initiative-wide technical assistance and evaluation activities, which Maddie and I try to make as fun as possible, as fun as you can make evaluation. And there is a 6-month progress report and expenditure report that's due a month after the 6-month mark, and final report that's due a month after the grant concludes. And then also participation in at least one site visit is also required. So not asking too much. You'll be the judge of that. But at least you know beforehand what you're getting yourselves into. And then grant timeline, you're at the workshop today. We are providing technical assistance for you to complete your applications between now and September 4th. And we'll provide a contact information for you to reach out to. I think it's also in your RFP and application as well. So we are happy to, throughout this process, answer your questions and provide as much support as possible. We will not be writing your applications, but to the extent that we can support you, we're happy to do that. Applications are due September 7th. We'll be conducting site visits as well as having finalists present to our Community Health Coordinating Committee. That's the group that is making the recommendations to our leadership. And those will take place between October 15th and October 26th. So finalists will be notified, and then we'll work on scheduling those site visits and the presentations with you. The presentations are usually about 10 minutes long. Really, I think one thing that we learned in the first round is it was helpful to hear you talk about your programs. You can only get so much from a piece of paper, but when we get to talk to you and kind of hear the passion and excitement behind the work that you've written in your application, it's helpful. Grantees will be notified in December, and the grant begins January 1st, and again, it's a 12-month grant cycle. Any questions before I get into the application itself? Yes. Yeah, and I'll go back to that slide because I think it will be helpful. So essentially what we're looking for is that you are thinking about your specific program and the populations you serve, and if there are specific barriers or conditions that even if you implementing your program perfectly would still exist and make it hard to see the outcomes that we are wanting to see in terms of improved behavioral health and health of our community. So those could be things like, wow, we have all these different organizations providing similar services. We're not communicating well, and our potential patients don't know where to go for what. And so a systems change would be working to improve that communication and streamlining that kind of process so that a potential client knows where to go for what service. So that would be, say, a partnership, a collaboration amongst community organizations that are working and providing similar services, but saying, okay, how do we make the process for finding what service someone should go to easier and less cumbersome. And so you're creating kind of new systems or new approaches that would help address that particular barrier. I think another example could be working with school district to enact like new policies around the provision of behavioral health services in schools, right? I don't know exactly what those policies could be, but it could be working with community organizations and parent groups to really advocate for new policies within the schools. But, any entity where there's opportunities to create new policies or new procedures to make it easier for folks to either access services or really addressing those barriers to accessing services could be an approach for policy and systems change. Does anyone else in here have it? I feel like the experts are in the room, so I don't know if anyone else wants to offer up an example or something they've been thinking about. Don't worry, they might not steal your idea. No. But again, we're here to help you think through that. So as you're thinking about, okay, we think this is a policy and systems change effort that we want to embed, and you want to have a conversation with Maddie and I, we're available to kind of talk through that with you and say, yeah, that sounds kind of like it fits with what we're thinking about, or no, you may want to consider some other approaches.
Encourage them to overcome those barriers. I don't know if that really applies.
Yeah,
it's a stigma.
that definitely would address one of the outcomes we're looking for, which is around stigma. So providing that education would. But I think maybe doing some, some further digging into what specifically, you spoke about kind of it being kind of a cultural norm, but what specifically are those fears? What are they rooted in? And seeing if there's some potential. I know one, maybe not directly related to your program, but one concern in the community is around accessing services for those who may not be documented. And so there may be some ways to address kind of policy and systems change by thinking about kind of, again, going, really understanding what's underneath some of those cultural barriers and fears.
And you're saying, so in other words, immigration issues.
Well, that's huge. That's huge.
Especially now.
But are there some new systems that you could implement that helps address those fears and concerns? Or education that helps to support that? Because then you're dealing with kind of the conditions that exist, and it's not just about implementing your program, but also doing some other things to address some of those underlying barriers. Yeah, but great example. Any other questions? All right, I will keep us moving forward. So now into the application itself. So we tried to make this as brief as possible, but there's so much we want to know about you and the work that you're proposing. So in terms of requirements, what is considered a full application package would be the application itself, meeting the criteria is bulleted here. We're also requiring that you complete a logic model. Has everyone heard or seen a logic model? A few of you have. Who has not? We have our evaluation toolkit, which can be found on our website, that gives you a great kind of overview of what logic models are and even an example of a logic model, and the template is found there as well. But again, you can tap into technical assistance. Maddie and I are happy to talk your ears off about logic models. So we are requiring a logic model, we're requiring an evaluation plan and a work plan. All these templates are found on the grant website. But again, if you have any questions about these documents, we're happy to support you with completing them. We're happy to explain, kind of what goes where. So don't hesitate to reach out. We're also requiring that MOUs are signed as a part of the application package.
Are you providing MOUs, or is the organization developing their own?
Organizations can develop their own. Great question. Yes. Right, Monica? Yeah. Great. We're asking for a list of key staff. Again, we're asking that all of these be attached, and we would greatly appreciate if they're attached in this order. It makes it really easy for us to go through your applications. So starting off with the application itself, the completed logic model, evaluation plan, and work plan, your MOUs, and all of this is in the application itself. A list of your key staff and all participating organizations, a list of officers and board members, detailed budget, and again, we don't have a budget template, correct, Monica? It's your own budget template. Detailed agency budget for your organization, most recent audit of your financial statements, and a copy of your IRS tax exempt letter. Those are all, that's what a full application package entails. So don't miss any of these pieces. Okay. All right, so the application itself, essentially we want you to tell us who you are. And so the first three questions are around background, general information about your organization's history, and the clients you serve. And then also a case statement. Why do you exist? Who's benefiting from your program? And how are they benefiting? Next, we want you to tell us what you do. And so this starts off with kind of the need statement, really understanding what is the need for the services that you provide. We encourage you using some data source to describe the need. So going beyond just saying we feel it, we see it, having some data to support the need. You can use Cottage Data to Go, which Monica will be talking through shortly, or other data sources. Again, Maddie and I are happy to help you identify data sources to support and demonstrate the need for the populations that you're serving. And then we also want you to describe the program, provide the evidence. Again, what's the evidence behind the program or the approach that you're taking? And then what is the policy and systems change effort that you'll be implementing? And then we want to know how you'll do the work. So describing your partner organizations, your staffing, and also how you're allocating resources to support the work. And then last but not least, we want to understand how you'll be measuring impact. So understanding the outcomes that you're addressing. Again, we listed the outcomes in our RFP. We went through. So pulling from those examples and talking about how you're going to demonstrate impact towards those outcomes, or a movement towards those outcomes. And then also requiring the logic model and evaluation plan, which are on the grant website. And then lastly, sustainability plan. Now, this is not a fully thought out plan. We know that there's so many other factors that impact sustainability, but question 16 is really getting at how you're starting to think about sustaining your programs. How might you go about setting up those conditions to have your program sustain even beyond grant funding? And I think, when we talk about sustainability, one of the questions that comes up for our leadership too is around staffing, right? If a whole position is covered through our grant funds, it does raise questions about what happens then when grant funds end. So if you are funding staffing through the grant, it's going to be important for you to talk about and help us understand what does life after grant funding look like, and how might those positions or some semblance of those positions be sustained, and how you're planning for that, if that makes sense. And that is it. Hopefully I've made you feel like this is going to be a breeze. You can do this. I want to encourage you. We're so excited that so many people came, and really looking forward to seeing your applications.